What I plan to discuss today is a brief overview of skin structure and its physiological functions, and relate that to the use of nutraceuticals in terms of normal aging skin as opposed to photo-damaged skin, and probably also the role of stress being associated with the aging process as part one of three that I'm presenting at this conference, and this is the first part. Okay. All right. As you know, the integument is the largest organ in the body. It's also the heaviest organ in the body. It's about constitutes about 16% of the total body weight. It has a surface area of about 2 square meters and about 2 millimeters in thickness. And you would think it would be very difficult to study skin, but it's actually very easy to study skin when you've got a multiphoto microscope that can actually get down to about 2 microns, and you can actually see inside skin cells and see what the organelles are doing. And if you look here at a section through the human thigh, you can actually recognize that there are different areas. For example, the epidermis, which is the epithelial cells, that's where they are. This is basically the skin, and the dermis, with connective tissue, and then the hypodermis area, which is mainly adipose tissue. And there are a number of associated structures associated with the skin, like hair follicles and hair and sebaceous glands. And there's an epithelium, which is affected by epithelial growth factors. And this is very important when you're talking about nutraceuticals, because the skin, like every other organ in the body, is in a perpetual state of inflammation. It's in a perpetual state of reactivity. It's down-regulated when it's in the lower phase, and it's super-regulated when it's in a higher phase of activity, so for example with the innate immune system when it becomes activated. And we also recognise that there is a difference between thick skin, which is the skin on the palm or the soles of the feet, and you can see how extensive the epidermis is when you compare it to thin skin that overlies the hand or the abdomen or the face, and you can see that there's an incredible difference in terms of thickness, less connective tissue. And when you're looking at the deep anatomy of the skin, you're actually recognizing that there are dense irregular connective tissues, and there are elastic fibers that decrease as we age. It has a genetic factor, but there are also extrinsic factors that actually cause these elastic fibers to decrease in number. There's variable thicknesses according to different parts of the body. There are blood vessels, sweat glands, so there are a number of deeper reticular layer structures. In terms of the physiology, it can actually regulate body temperature. The sweat glands are there to do this. There are changes in peripheral blood flow. There is sensation. There is protection. It's a very important protective barrier. And there is excretion in order to maintain some sort of regulation for the body temperature, heat, water and salt losses, and there are also losses of organic compounds. And it's also a blood reservoir. It's very, very important because nutrients come to the skin via the blood. Vitamin D synthesis occurs at the skin, and when you talk to your patients about where they should get the sun so that you get vitamin D, it's in the abdomen. It's in the areas where there's fat tissue, not in the face or on the arms or on the hands. It's actually in the buttocks, the back of the legs, the back of the thighs, I guess, and the abdomen areas. That's where the provitamin is, so that you get effective vitamin D synthesis. And there's also a structure or a melanin, a substance, and the inability to actually produce this is called albinism, and you can see that it occurs in nature, not only in man, but in a number of different species. And why is this important? Because it is a substance produced by the keratinocyte, that the DNA, that is actually a protective mechanism. The darkening of pre-existing melanin and releasing to keratinocytes can actually accelerate the synthesis of melanocytes. Why do I put this why do I put this here? It's important to understand metabolism. Today we've actually forgotten about metabolism because everybody talks about genetic material and that everything is to do with the genes. The genes are not set in concrete. They're sitting there responding to metabolism. And the skin will respond to metabolism, and in particular nutraceuticals that up or down regulate the activity of keratinocytes. And I'll show you that in a few slides in a minute. Just to show you diagrammatically what happens, there's synthesis and injects melanin granules into the keratinocytes, and you can see it there. So what's going on? The melanin granules and developing melanin granule further down here. And what we see is also melanocytes migrating to the epidermis from the neural crest during the embryogenesis to produce a pigment in the skin. We can actually see this under the multiphoto microscope. There are a number of causes of skin disorders, as you all would know. There are chemical, mechanical, physical and biological changes or biological insults, and these can be associated with disturbing a number of parts or functions of the skin. And when we then relate this physiology and this microanatomy to aging skin, what we actually see is that wrinkles are actually caused by damage to the fibres in different layers of the skin, and it becomes less flexible and more fragile. And when you get young people who actually wrinkle their skin purposely, the skin actually comes back to normal, back to a youthful looking skin. And it's these fibres that are maintained in early age that we then lose as we age that are associated with producing a lot of the wrinkles. And again, it's a loss of elastic fibres. Collagen synthesis is decreased. There's extensive cross-linking of the collagen fibres, and there's this reduced content of collagen that actually contributes to the wrinkles by weakening the bonds between the dermis and the epidermis. So the bond, that very, very important bond is actually decreasing as we age. Part of maintaining that bond is to maintain skeletal muscle mass, because as we'll see in part 3 of these lectures that I'm going to give tomorrow, the loss of skeletal muscle mass is probably the #1 marker for aging. We're losing skeletal muscle mass somewhere between 5 and 10% from the age of 55. And the more skeletal muscle mass you lose, the worse the wrinkles are. Now, there are 2 types of aging of the skin that we recognise. There's intrinsic skin aging that's actually largely due to genetic factors, and extrinsic skin aging due to the environmental factors such as sunlight and extra UV exposure and smoking and other poor nutritional factors. And when you look at photoaging, this is unrescuable. No matter what kind of an antioxidant or nutrient or green tea or herbal product you have, you cannot rescue this. This is just beyond rescuing. And when you look at photoaging, it actually may account for about 90% of the age-associated cosmetic skin problems, from the actinic keratosis and skin cancer up at the top of the list, which is in red, to the formation of telangiectasia, rhytides, mottled hyperpigmentation, elastotic changes that actually include the skin becoming lax and enlarged pores, and obviously it's also got a coarse texture and it looking somewhat pale and sallow. Now, the comparison, when you do research, it's very, very good to have comparisons in terms, and when you've got a plastic surgeon like this guy over here who gives you the skin, it's very, very good to actually do comparative studies between intrinsic versus extrinsically aged skin. And I thank Michael for the skin that he gives us. And when you look at, now this is the skin of an 80-year-old woman, and you can see that there are intrinsic changes in this skin, because it's coming from the inside upper arm of this particular person, which is really sun protected. And the skin manifests as a result of gradual atrophy of the epidermis, which may undergo thinning by about 10 to about 50% between the ages of 30 and 80 years. And you can actually distinguish a distinct flattening of the dermoepidermal junction, which occurs, resulting in a decrease in the surface area by approximately about 35 and probably 40%. And when you compare that to skin that's actually been sun exposed, you see the incredible difference in terms of the thickened epidermis,